and the hospital was completely understaffed. The thing that kind of made it feel surreal for me was that every single doctor, and there were 6 doctors that saw me that day, that said, "We're not ruling it out," offered me the option of doing a lumbar puncture. And a lumbar puncture is also known as a spinal tap. And for those of you who don't know, a spinal tap is where they insert a needle into your spine and they extract cerebrospinal fluid. The worst part was I was alone for this entire time. Hi guys, welcome back to my channel. I know it's been a little while since I've posted a video, and that was not by choice. I actually had a lot of fun videos planned for the end of December. I was really looking forward to recording what it's like to have finals week in dental school, do a few giveaways for you guys, and I unfortunately was not able to do all of those things. And as you can tell by the thumbnail and the title of this video, I actually ended up in the hospital. So it essentially happened the last week of classes. On around Sunday evening, I started having just like a headache, but it's nothing that I haven't had before. And then on Monday morning, I woke up and the headache was still there. And so on the 3rd day, on Tuesday, when after hydration and taking painkillers didn't help, I decided to go see my primary care doctor. When I came in, I told her essentially what had been happening was that it started out as a regular headache, but then it became much different than anything that I had experienced ever before. What I mean by that is that when I would like bend over to pick something up or pick up my dog, and I would laugh or clear my throat, any kind of change in my positioning would cause me to have insane pressure around my temples, and sometimes when I would go from lying down to sitting up, I would even get dizzy. And so when I came into my doctor with the kind of nondescript symptoms and started telling her how I've been feeling and that it's been happening for a few days and that painkillers weren't helping and hydration wasn't helping, she got really concerned. She decided to do blood work. Then, because my doctor was really concerned about the way that my headache was presenting, she actually sent me for an MRI. When that happened, I became a little bit concerned because I thought, well, this is not just a headache anymore, right? I've never had been referred to an MRI before. I've never had it done. So I thought this must be a little bit serious. So I went to see my primary care doctor on Tuesday, and I got in to get my MRI on Wednesday. And they looked at my brain and they said, there's really nothing there that could be causing your headache. So my doctor was worried about maybe something with the vasculature might be wrong. Worst case scenario, she was considering a CSF leak, and the MRI didn't reveal any of that. It's actually kind of ironic that that is what had been happening, because we were doing head and neck anatomy in block 3. So when I had been studying, that was exactly what I was learning. And so a lot of these things were kind of just like really strangely close to home when I was talking to my doctors about it. But I got the MRI, it's Wednesday, I still don't have an answer, I still have the headache. And then Thursday comes. And on the night from Wednesday to Thursday, I wake up at probably 5 o'clock in the morning and I have a fever. The fever is at 102. When I initially came to see my doctor, because I had been learning head and neck anatomy and all of that, I kind of jokingly said, oh doctor, maybe, could it be meningitis? I was purely joking, but in the back of my head thinking, explore all the possibilities, right? They say think horses, not zebras, but none of the horses were giving me an explanation, so I thought maybe it's a zebra. I mentioned that to my doctor and she said, no, you don't have neck stiffness, and she did a test to see whether or not I did have neck stiffness, which I didn't. She was saying how it's just a headache, you're not presenting with a fever, so it's probably not meningitis. So she essentially just ruled it out. And so then when I woke up on Thursday morning, it was really early and I was having a 102 fever, which was no longer a light fever. I became very concerned. And so when I called my doctor to tell her what I was feeling, she essentially said that it was worth it for me to see a neurologist, go to the hospital, because with the level of knowledge that she has as a primary care physician, she could not figure out what was wrong with me and they needed to do more diagnostic tests. And I came into the emergency room, and during the day, the fever started getting really, really intense. So by the time I got to the ED, which was around, I want to say 1 p.m., the nurse saw me and then a PA saw me and they took my temperature, and so they kind of brought me in relatively quickly. But then once I was in the ED, I had an initial conversation with a nurse, and so what happened was that based on my symptoms, I was not considered an urgent patient. Obviously there were patients that were coming in that were much higher priority, people in cardiac arrest, people giving birth, and so many other things that I understood completely that I was not a top priority for them. It was also an extremely busy time, the week before Christmas, and so the ED was really busy and the hospital was completely understaffed. One of my friends actually worked works as a nurse at this hospital. I even spoke to the nurses that were in the ED at the time, and they essentially told me that floors were completely understaffed. Floor with 30 patients that's supposed to have 8 nurses would have 3. So it was just a really stressful situation for both, I'm sure, the patients and the staff. And I had worn my Columbia, not this one, but I had worn my Columbia crew neck. I kind of did that on purpose because in the medical profession, people tend to respect and kind of level with their colleagues a little bit more. So I told them essentially in my first year of medical school, so you can feel free to, the jargon, use the terminology, I kind of understand what you're talking about, and so that's what they did. But it was actually kind of funny. So when they were putting in an IV, the first attempt was done by a 3rd year medical student, and most people would shrug off and say, oh no, I don't want anybody practicing on me. But I knew it was a teaching hospital, and I, as someone who is in the medical field and is getting a medical education, I was not going to object and say, no, she can't practice on me. Obviously, there was a senior nurse that was standing right by her that was supervising, but she did pierce right through my median cubital, which is where they normally take blood from in your arm. And the nurse actually had to, once the needle was in, she had to this is probably graphic, so disclaimer, but once the needle was in, the nurse actually had to pull up on the needle in order to actually get some blood out. So that wasn't fun. So then they had to go into my other arm. But then one of the residents came by to talk to me, and he was one of the internal medicine residents. And he had actually just graduated from the Columbia MD PhD program. So he was kind of like, oh, you're going to my alma mater, that's really cool. Oh, is this professor still teaching there? So it was kind of nice. We established a rapport, made me feel a lot more comfortable. So I described my symptom that had no sudden onset. It wasn't like a lightning strike kind of headache. It started out as dull, and then it kind of persisted. And then I told them that I was having the fever. So that is when, after a very long conversation, I was in for a slew of tests. So the first thing that they decided to do, obviously, was blood work. They did a urinalysis. Eventually, also, they had a neuro resident come and see me. And then actually there were 2 residents that came to see me. One did a full physical exam. They checked my reflexes. They checked whether or not I had weakness in my arms or my legs. If I had stiffness anywhere that could indicate a neurological condition. And thank goodness, everything checked out. I made the same joke with them that I made with my primary care doctor, and I said, I came into my primary care doctor and I thought, haha, maybe it's meningitis. And the thing that kind of made it feel surreal for me was that every single doctor, and there were 6 doctors that saw me that day, that said, we're not ruling it out. Things kind of became a little bit more serious for me. So I thought, okay, this is something that is not to be treated lightly. They're taking it very seriously. I don't mind going through whatever test you need to do, just figure out what's wrong with me. And so they did. After a bunch of tests, including a respiratory virus panel, because one of the residents that came over initially thought, okay, well, COVID cases have been going up in New York, so this could just be a non-traditional presentation of COVID, because there have been patients that were coming in for a headache that was related to COVID. And so I could kind of see where the resident was coming from, but I wasn't having any of respiratory symptoms at all. So I had COVID in December of 2020, and the symptoms, I guess there are different variants around, but there was nothing that was the same from that. The only thing that was in common was the fact that I was having a fever. I really thought that this was not it, but I was waiting for the tests to come back just to rule it out. They did a full respiratory viral panel, and the crazy thing is that obviously the tests were taking some time, but every single test without fail was coming up normal, or nothing was substantial enough to pursue in terms of treatment. Everything was within normal levels. The more that these tests came back clear, you would think that I would be relieved, but I wasn't. I got even more frustrated as the hours went by, and at this point it was way into the evening. There was a shift change, and then the new doctor that was going to be taking care of me came in and essentially said that she took a look at all of my tests and my blood work. So she said that essentially they were going to discharge me. And so this was around 11 o'clock. So I thought, okay, well, if they feel comfortable letting me go home, it must not be so bad. But then as the doctor went to go and type out my discharge paperwork, she had talked to the neurology team because they had consulted on my case while I was in the emergency room, and so she needed them to give her the go-ahead to discharge me. So because everything had been coming back clear, the neurology team decided to do what it's called an MRV. Oh, Actually, I missed a big part of the story, and it's probably the worst part of the story. So once all of the blood work and everything else was coming back clear, including the respiratory panel, I was negative for COVID twice, and none of the other respiratory viruses were coming back positive. Because my doctors were still unsure and they had not ruled out meningitis or encephalitis, they offered me the option of doing a lumbar puncture. And a lumbar puncture is also known as a spinal tap. And for those of you who don't know, a spinal tap is where they insert a needle into your spine and they extract cerebrospinal fluid, which is the fluid that keeps your brain floating in your skull. It also fills your spinal cord. They thought that since everything else was coming back clear, they were offering me this option to rule out anything that, you know, I could potentially be going back home with, even though it was essentially serious. And this was not something that I was eager to really do because I understand the severity of what a lumbar puncture is. I understand the possible side effects. You know, you could have what's called a low pressure headache because of the fluid imbalance with your brain, and it could be very severe, and you might even have to have something called a blood plug to, you know, plug the fluid from leaking out to restore the CSF balance. But at that point, I was kind of desperate, and the doctors really wanted answers, and so did I. So I agreed. The worst part was I was alone for this entire time. That was probably in the emergency room for 8 hours at that point. I was still struggling with the fever. I was just, you know, laying in a hospital bed in the hallway because my situation wasn't serious enough to warrant putting me into a room. And so then they take me to go and get the lumbar puncture. The doctor that had been with me and treating me was a first-year resident. And so although he had done extensive training and someone is doing something for the very first time, you kind of start to feel a little bit iffy about that. He and a fourth-year resident had much more experience. He was doing this regularly and he didn't require supervision, but since my doctor was a first year, he was going to perform the procedure with the supervision of the fourth-year resident. So again, since I am essentially in medical school right now, I thought, you have to let people learn. I was lying there on the table, I was in fetal position, you know, crouched up and just anticipating what was going to happen, and feel, I guess, more at ease when I'm told what is happening. So the fourth year resident was walking me through it along with the first year resident who was about to do a lumbar puncture for his first time. And so first, you know, they, you know, covered my back with betadine, made sure everything was sterile. And then I gotta say, the anesthetizing process was worse than the lumbar puncture itself because I just felt, again, warning, if you don't like needles and you don't like the conversation about medical terms, you can kind of just skip through this part of the video. But so I essentially felt the needle going in, and they had to go in several times and go kind of all the way around the incision site in order to numb the area. So the first round of the injections was the worst part, I would say, until the end. And then, you know, they had to go in and do a second round, but that I felt less because obviously the lidocaine had started working. My doctor had attempted to place the needle in the right spot to extract the CSF, but because of the angulation being off, he kind of missed. And I know this is very graphic. Again, if you don't like these descriptions or you're not comfortable with it, feel free to skip through. But I felt the needle kind of just scrape along the side of my vertebra. And it was very, very unpleasant. It was a very, very unpleasant experience. And then, so the fourth year resident then let my doctor try again because, you know, if you can't do it the first time, try it again. So the second time that he went in, the angulation was still off, and again, I felt the needle scrape against the side of my vertebra because yes, the muscles and the skin was numbed, but on the inside, I was still feeling everything. And so when it came time to try for the third time, I politely asked the fourth year resident to go ahead and do it that time. And you know, I really didn't want to offend my doctor, but it was nothing personal. I just started worrying about side effects and going in too many times because if they had not been able to complete it between L4 and L5, they would have to go and get an attending and do it a little bit higher on my spine because don't want to mess with your spine too much. I'm sure you guys can understand why. There's a lot of nerves, vasculature there. So the third time, telling him, you know, could you please do it this time? And he was like, yep, I already have it in my hand, don't worry about it. And they were both really, really nice and really sweet and tried to make it as painless of an experience for me as they could, which I really appreciated because it was definitely not a good experience that I was having. In order to prevent the low pressure headache or any of the other side effects that come with a lumbar puncture. And by the way, they take out kind of a lot of fluid. They take out 40 cc's, which if you think about it just in general, 40 cc's of fluid is not that much. But then if you think about that coming out of your spine, that kind of seems like a lot. After the procedure, you have to just essentially lay flat on your back. You can barely even have a pillow under your head for exactly 1 hour. You can't get up and go to the bathroom. You can't do anything in order to prevent some of those side effects. So then it was just a waiting game. Most of my results had come back by then, blood work, respiratory panel, everything. And so then I was just waiting for the lumbar puncture results. And so that's when at around 11 o'clock, the new doctor that had come in after the shift change had come in and told me, you know, your lumbar puncture results were clear and I'm ready to discharge you. And then she went to type up the paperwork, but then she spoke to the neurology team, and because my lumbar puncture had come back clear, the neurology team suggested that we get an MRV of my brain, which is an MRI that specifically focuses on the veins in your head. And the reason why they were concerned about that was because of something called venous sinus thrombosis. And it's kind of funny. I can laugh about it now, even though at the time it was a very scary situation, is that during block 3, we were learning about all the venous sinuses in our brain. And so I thought, okay, I know exactly what they're concerned about, and I can understand why they may be concerned about that. You know, a venous sinus thrombosis is essentially a clot in a vein in your brain. And so they thought that that might be causing my headache. So they sent me for the MRV. At that point, I became even more frustrated because that would mean that at 11 o'clock, I was still not being discharged. My family was still waiting for me there. An hour later, they took me for the MRV, and guess what? Came back clear. And so at that point, there was nothing else. They had exhausted essentially all diagnostic methods that they could try and explore with the symptoms that I was presenting with. And because everything was coming back clear, they were able to discharge me. And so at 4:30 in the morning, I was discharged from the hospital. My family had already left because they had work the next day. You know, I took a lift home. And the next day I was just at home. I was recovering. I was taking my Tylenol, ibuprofen, all that, and really hydrated. So that was Friday. But then at night, my fever started going up again. From Friday to Saturday, my fever then spiked to 104. And when I started taking fever reducers, Tylenol, ibuprofen, I was taking them in the appropriate dosages, but nothing was bringing down my fever. It would bring it down marginally to like 102.7, which was still very high. And then an hour later, it was going right back up. And so at that point, I figured I have to go back to the hospital. There is something that is going on that I am not able to manage at home. And so they started running more tests. This time, thank goodness, it was a Saturday. My boyfriend was able to come with me, and at that time they were able to put me in a room. And so they just started asking me more questions, running more tests, doing cultures of things, and just hoping that they could find an answer. But after another very, very painful and exhausting long day, they still were coming up short. You know, respiratory viruses were coming back clear. There was something in my blood work though that was a possible candidate for my symptoms, even though it was not a classic presentation of what I had, because I had IgG and IgM antibodies in my blood. And it's funny because we also had immunology this block, and so I knew exactly what it meant to have IgG and IgM antibodies for something. So again, it was just kind of interesting how my education was playing a role in, you know, something very real and tangible that I now could apply my knowledge to. It definitely, even though this was right before exam week and I couldn't study, it definitely helped to reinforce a lot of the knowledge that I had. That's when they decided to pursue a course of antiviral treatment, even though I needed to wait for results of a culture to come back, you know, which could take a couple of days. They felt comfortable enough to go ahead and treat what they likely thought that this is with an antiviral, and hope that my symptoms were starting to ease up. Those cultures eventually came back negative. The antiviral worked for whatever reason. The doctors still didn't have a diagnosis for me. They didn't know what I had. There was no concrete thing that it could have been for sure. The only clue was those antibodies that I had, but because there were IgG antibodies present, that means that it had been in my system for a little bit of time in order for those antibodies to develop. So it could have been an old recurrent infection that was not necessarily what was causing my symptoms, but the antiviral worked and symptoms cleared up a week later. I was not having fevers anymore, and the headache eventually went away as well. But that experience, it just made me think about a lot of things. It made me incredibly appreciative for our healthcare system, even though it's incredibly flawed and even though our healthcare professionals are stretched so very thin. I was so thankful for the nurses and the doctors for making the best of it, and the fact that they were able to give me a certain level of respect and level of me because I'm a dental student in medical school. I was incredibly appreciative for my support system. When I came into the ED, and I was wearing the sweatshirt, one of the doctors actually made a remark saying, "Oh, this is exam week, right? You're probably just stressed out. It's probably nothing." I was almost offended by that because I'm a student doesn't necessarily mean that the symptoms that I was experiencing were psychosomatic, because there was clearly something wrong and they could tell that something was wrong once they did all the tests and the picture became a lot more clear. But at first, one of the doctors was just saying, he kind of dismissed it as it's either just a presentation of COVID or you're just stressed out from exams. And although I could kind of see why you would think that, because right before exam week, most students are really stressed, but for me, I was kind of doing okay. I was keeping up with the material. I wasn't super incredibly stressed out. I was in good shape until I had gotten sick a week before the exam week started, and then I physically could not study because the headache was just so intense that I could not look at a screen for more than 5 minutes. I couldn't read on paper. I couldn't do anything. I was just lying down on the couch under blankets, and I sometimes would have insane chills, and I felt like I was in the middle of Siberia even though I was in warm clothes and under 3 blankets. It also taught me for my future experiences with patients not to just discount something as the immediate obvious answer. Obviously, no one wishes that this happens to them, but I kind of thought about how much I learned and all the new things that I can now apply to be a better clinician, be a better doctor, be an advocate for myself, knowing and having some sort of background, but also how important it is for people to kind of just advocate for themselves and not rule out certain things until you know for sure. To think about, risk versus reward with certain things. Like for me, it was doing the lumbar puncture, but when everything else was coming back negative, it was essentially the only thing that they could do that could possibly yield an answer. And so I definitely thought that the risks did not outweigh the benefits for me in that case. And so I guess what I'm trying to say is that I hope that we all go into 2022. I know it's already 2022, but I hope we all go into and start this year very healthy. Even if you are not in the healthcare field and you just come into the hospital or anywhere really as a patient and you're experiencing something real and you know what you have and you know your own body and you know this is not the norm and this is not something you had before. I was asked questions like, oh, have you ever had migraines in the past? Maybe this is a migraine. And so I had to kind of really advocate for myself and say, no, this is not something I've ever had before. I don't have a history of this, and this is not because I'm stressed out for exams. Like, this is something that is very wrong. My fever is not going up to 104 for no reason. I'm great now, thank goodness, knock on wood. Take care of yourselves, guys. Make sure that you go to a doctor, go to your primary care physician. I know I'm looking at some of you guys who have probably not seen your primary care physician in like 5-6 years. Go see your doctor, get some blood work done, make sure that you're all good. I'm glad it's over. And I was very fortunate that Columbia let me postpone taking my exams. I actually finished taking my last exam literally on the last day of winter break. And so, I had to spend my break studying, but I was really grateful that I was even able to push back taking them because at the time, I was just not in any way, shape, or form going to be able to take them and do my best. And so I'm really grateful to the school and its administration for being so accommodating and allowing me to postpone my exams and take them whenever I was feeling better. That is where I've been for the past month. I'm so sorry that there haven't been any new videos, but I actually posted a poll recently of a lot of video content that I'm really excited to make. make for you guys that I was going to make in December, but now I'll make it in January. But I want to know what you guys want to see first. I want to make a video about how I studied for the DAT and as well as giveaway course that I used for one of you guys, and thank you for 500 subscribers, which was really insane. I'm gonna leave the options in the description so you can drop a comment and let me know which one you want to see first. I will be making all of them, and I will be doing a few giveaways now in January. I think it'll actually be kind of nice, you know, now that the holidays are over, you know, and you're no longer giving and receiving gifts from other people. Now I'm happy to give you guys a few gifts and give away some things that I'm really excited about to some of my followers. And so I don't want any of you guys to worry about me though. I'm feeling a lot better. Modern medicine works. It's great, even though, you know, you're not always able to get concrete answers. So yeah, I will be back later this week with another video. So stay tuned for that. Thank you all so much for subscribing. And if you're new here and if you've stuck around to the end, thank you so much. My name is Medina. I make videos for pre-dental students and I vlog my dental school journey. So I would love it if you could like this video and subscribe down below. And I will see you guys in the next one. Bye.